So there's two issues here. First of all, in January and February of 2020, NHS England did a stock take, I think, of PPE. Is that right?
No, I think that was Public Health England and
Right.
the Department of Health and Social Care, because
Okay.
Public Health England was responsible for creating and overseeing the PPE stockpile
Yeah.
that supposedly would be sufficient if a pandemic struck. And
Yes.
as we all now know, it wasn't.
It wasn't sufficient. So
Correct.
and as the Chief Executive NHS England, that would be a major concern to
Yes.
you and of great relevance, whoever did the stock taking.
Absolutely.
Yeah. So that's sufficiency. So first of all, it's insufficient. In 2016, NERVTAG had made a formal recommendation to the Department of Health that there should be a rolling NHS programme for the fit testing of respirators, FFP3 masks, as an important part of infection control. That's right, isn't it?
I'd need to see the NERVTAG papers. I'm not disputing that, but I need to see them, yeah.
As the Chief Executive of NHS, this is something directly relevant to you. Let me put it up on the screen, and hopefully that will jog your memory. So under discussion points and stockpile, fit testing in the face of an emerging pandemic is a major challenge. Just-in-time fit testing was proposed. However, there may not be sufficient time to put this in place between pandemic virus emergence and the first UK impact. It was agreed that there's no substitute for a rolling programme of fit testing in NHS trusts during inter-pandemic periods.
Well, I mean, this is the first time I've seen this document, but yes, I can read what you've put up there.
But you were in Chief Executive from 2014.
Sure, but this was a document, I think, to Public Health England,
Yes.
the Department of Health and Social Care, wasn't it?
Fully take that point.
Sure.
It directly relates to the NHS. It's a recommendation that the fit testing rolling programme should take place across the NHS, and you're the Chief Executive.
Yeah, and it may well be, but I do not want to give you an answer that is not fact-based. I can certainly ask that question and make sure you get that answer. But clearly, if just really skimming this document now, seeing it for the first time, it appears to be suggesting that fit testing was obviously specifically confined to intensive care units. The issue with COVID was obviously that it was a much wider set of requirements, and frankly the pandemic planning for influenza flu was wide of the mark for the sort of PPE requirements that COVID brought about.
Yes, Lord Stevens, this is a document related to pandemic flu. It's related to PPE. It's related to a recommendation for a rolling programme across the NHS.
Sure, but
did you know about that recommendation or the issue?
And I didn't know about that specific recommendation.
Yes.
But just to be clear, the recommendation in respect of pandemic flu, it was a completely different set of PPE requirements. Well, not completely, but substantially different. And the type of staff who would be involved in this type of fit testing, as I think this document itself suggests, were different than what we ended up with. So look, there's no doubt that...
We're talking about respirators with a respiratory virus. That you've told us that by the time it's raised with you in April of 2020, there was ongoing consideration about fit testing and the propriety of the types of PPE that you had. Was there a rolling programme of respiratory fit testing during the period from 2016 to the 2020?
Well, I think it's likely there would have been in those parts of hospitals and health services that were using that PPE. But as I say, I don't want to speculate. Let's find out the facts and get those to you.
Yeah, OK, well, that's very helpful. It's just that when you said that there was ongoing work, you obviously did look into this in April of 2020.
Yeah, that was ongoing work as then recommended for COVID. Yeah,
I understand that. But did you understand when that ongoing work had started?
Well, this was specifically in response to COVID, where a far wider group of health service staff were needing PPE.
Yeah.
So I think that's what the Chief Nursing Officer and the National Medical Director were focusing on.
Of course, the context is COVID. That's what you were dealing with. Yeah. But finally, this. Had there been a rolling programme of fit testing across the NHS. Do you agree with me that these problems with non-fitting PPE for women healthcare workers or black and minority ethnic healthcare workers would have been flagged up much earlier and would have been dealt with or should have been dealt with prior to the pandemic?
No, I think almost the reverse, because if you were doing it in a situation where there was ample PPE supply because there wasn't a pandemic on, you wouldn't actually have detected the problem. It was only when the shortage arose that it was so evident that there was a problem.
Those are my questions.